things are exceptionally challenging. The main reason why it's challenging is that the places that are most severely affected have been marooned from the rest of the island. They are inaccessible. And as a result, where you see hospital like in Black River, which has been all over the press, that hospital is inaccessible except by air. The other places a little bit further north, as the hurricane went from south to north, they are more accessible. But the real challenges are in this strip that goes from the Black River in the south to Montego Bay in the north. There's a challenge around information because despite the best efforts of everybody involved, it's difficult to collect all the details of the situation, the assessments of the communities and the health services that are there. The real damage took place in the western part of the island. On Wednesday, I was able to join the Prime Minister and the Minister of Health to do a trip with them on the earliest review in Black River, the ground zero of the event. We spent 2 hours both talking with people in the community as well as talking with people, the health workers at the facility in Black River. These people are heroes. But they also need help. The impact of the storm has had a terrible impact on the psychosocial support, on the emotional situation for our colleagues. They just talk about how horrible and how devastating the time was. After leaving Black River, the minister and I traveled to Montego Bay. And Montego Bay, of course, we associated with the beautiful beaches and the hotels, and those, of course, are part of the community that are there. We went to Cornwall Regional Hospital. Again, the situation there is very difficult. While Black River is completely evacuating the hospital, in Cornwall, they're not evacuating. They're trying to care for the patients that they have in the hospital as best as they can in very difficult situations. The Ministry of Health was really trying to move forward with its assessments, trying to understand what the situation is with water and sanitation issues, the infrastructure assessments. But it's been very difficult because the communications are non-existent in the most affected areas. In emergencies such as this, we operate in the system of no regrets. And while we are trying to save lives and preserve lives right now with critical patients needing to be evacuated from one location to another, we also have to think not only about clinical management of an individual, we have to think about public health, generally speaking. And that's what we need to address most urgently today as we try to deploy emergency medical teams to replace the destruction in many of the health facilities that we saw earlier in the week.